Welcome to the Explainer. Today, we are diving deep into Medicare. Specifically, we're talking about a really unique type of plan that's designed for people with very specific health needs. So if you or maybe someone you know is dealing with a chronic illness, lives in a long-term care facility, or happens to have both Medicare and Medicaid, then this is something you're definitely going to want to hear. All right, so let's get right into it. The moment you become eligible for Medicare, you're hit with a pretty big choice right off the bat. How are you actually going to get your health coverage? And trust me, it's a decision that really sets the stage for your entire healthcare journey. And when it comes right down to it, that choice boils down to two main paths. You can go the traditional route with original Medicare, the one run by the government, or you can choose a Medicare Advantage plan, which you get from private insurance companies. So let's break down what that really means. On one hand, you have original Medicare. The big plus here is freedom. You can see pretty much any doctor anywhere in the country as long as they accept Medicare. The catch? You'll have to get a separate plan for your prescription drugs. Then on the other hand, you've got Medicare Advantage. Think of this as an all-in-one bundle. It wraps up your hospital, medical, and usually your drug coverage into a single plan. But you'll typically need to stick to a network of doctors. Okay, so let's say you're leaning towards that Medicare Advantage path. Well, it's not as simple as just picking one thing off a shelf. It's actually a whole universe of different plans, and each one has its own rules, its own benefits, its own way of doing things. So here are the main players. You've got your HMOs and PPOs, and the big difference there is usually network flexibility. But what I really want you to look at is that last column, SNP, Special Needs Plan. Now look down at that last row for drug coverage. It doesn't say usually or sometimes, it says always included. And that little word is a huge clue about what makes these plans so incredibly different. So, what is it that makes a special needs plan, or SNP, so, special? The name really says it all. These aren't your average one-size-fits-all plans. They are custom-built from the ground up for people with very specific and unique health situations. Now, the key thing to get here is that SNPs aren't for everybody. They are designed to deliver highly coordinated care and super specialized benefits. This often means you might get a dedicated care manager, like a personal guide, to help you navigate all your treatments and appointments, which is a massive advantage. It's all about getting exactly the right care for your exact situation. So you can't just decide you want an SNP and sign up. Membership is restricted to people who fit neatly into one of these three specific buckets. You have to meet the eligibility rules for that particular plan. Let's break down who actually qualifies for each one. First up, let's talk about C-SNPs. The C here stands for chronic condition. And as you can probably guess, these plans are built for folks who are managing some pretty serious long-term health issues. So, to get into one of these, you need to have a confirmed diagnosis for one of the conditions that the plan is built to cover, things like diabetes, cancer, or chronic heart failure. The whole idea is to give you a network of doctors and a list of drugs that are all laser-focused on managing that one specific illness. Okay, so the other two types of SNPs are a little bit different. With these, eligibility isn't based on what disease you have, but on your life circumstances, either where you live or what other kinds of health coverage you might have. Now, the I in I-SNP, that stands for institutional. These plans are for people who live in a long-term care facility, like a nursing home, for at least 90 days, or for people who need that same high level of care, even if they're receiving it at home. The plan works directly with the facility staff to manage everything. And finally, we have D-SNPs. The D here stands for dual eligible, meaning you qualify for both Medicare and Medicaid. And these plans are a huge deal because they act like a bridge, coordinating all your benefits from both programs. That can make costs and care way, way simpler to handle. Okay, so we've covered who these specialized plans are for. Now let's just wrap this up with the bottom line. A couple of absolutely crucial points that apply to every single SNP, no matter which type it is. It really all comes down to this one core idea: customization. Everything about an SNP, the doctors they put in the network, the extra benefits they might offer, and especially the list of covered medications, is handpicked to serve the very specific needs of its members. Which brings us to a huge question, probably one you've been thinking about this whole time, and something we hinted at earlier. What about prescriptions? Are your medications going to be covered? And the answer is a big, resounding yes. Absolutely. It's not a maybe. It's not an optional add-on. For a special needs plan, providing Medicare Part D drug coverage is mandatory. Every single one has to have it. And, when you stop and think about it, that makes total sense, right? If you're managing a chronic illness or you're in a long-term care setting, having reliable, consistent access to your medications is absolutely critical. It's a non-negotiable part of the care these plans are designed to provide. So at the end of the day, SNPs really are one of the most personalized ways to get your care through Medicare. The big question is a plan that's this tailored, this specific, the right choice for you? Just understanding these specialized options means you're that much closer to finding coverage that truly fits your life. Thanks for watching.